I'm on the transplant list.
You're on the list. Congratulations.
Patients may know their complex lung disease by many names. They may know it as interstitial lung disease, as pulmonary fibrosis, or as another form of fibrotic lung disease. Having the right diagnosis for complex lung disease entirely determines the treatment plan. Patients who don't have the proper diagnosis are unfortunately very, very likely to have a fairly rapid decline in quality of life over several years, because a misdiagnosis is the same as the worst diagnosis for these diseases. I'm Erin Narewski. I'm an interstitial lung disease specialist at the Temple Lung Center. We are leaders in our fields. We have expertise in dealing with all of the different types of interstitial, complex, or fibrotic lung disease. These include idiopathic pulmonary fibrosis, interstitial lung disease due to a connective tissue disease or an autoimmune illness, chronic hypersensitivity pneumonitis. There could be a drug-induced respiratory disease. It could be an occupational or environmental lung disease due to an exposure in the patient's home or workplace. And it could also be sarcoidosis. Patients with complex and interstitial lung disease have all of the options, including transplant, medications, and lifestyle changes laid out before them, but they get help in making these difficult decisions from a team of experts that collaborates together to give them the best possible support. Treatment options are changing rapidly. Now we have non-steroid alternatives for the treatment of patients that can result in equal or better outcomes for them over the long term that have very few side effects. It's a joy to get to tell people that. We have access to one of the leading transplant programs. Every patient diagnosed with idiopathic pulmonary fibrosis is in need of a transplant center referral because of this disease having such a variable prognosis. So all patients require that transplant center of excellence to be by their side through their diagnosis. Temple does more lung transplants than any other program in the country. Transplant represents an option for patients at advanced stages of disease that can be life-altering. Not only can patients have a longer life than they might otherwise have had without transplant, but they also get to lead, we hope, a better life. I form very close relationships with patients. I get to celebrate with people with their gains, with removing oxygen, for example. That's one of the most exciting things. Is, telling people that you no longer need this tether that's held you to your house, that's prevented you from doing the things that you love. These are life-altering changes. It's a privilege to get to be there with people when they do this.